Hey everybody, this is Dr. Langdon, board certified pediatrician, mom of 6, grandmother to 3, and today's video is about SIDS and whether or not it could help to have a monitor. You guys know I love to have you ask questions, and I hope to provide some evidence-based answers. And a little tip, I try not to Google things just to share information because that can be dangerous, but I do use something similar. I think of it as Google for actual physicians, and that's an app called Up to Date. I love it, and it puts together a lot of data and evidence and clinical practice guidelines from professional societies, so it's very useful. So I do use some of that sometimes to get my actual facts and data. So here's the quick story. You cannot rely on monitors to prevent sudden infant death syndrome. So you guys probably know SIDS is any unexplained death under 12 months, but 90% of the cases are under 6 months. It's often actually between 2 to 4 months. And we know that there are lots of risk factors for SIDS, such as maternal smoking, very young moms under the age of 20, co-sleeping, soft bedding. So we have all kinds of things we recommend to decrease the risk, like keeping the room temperature cool between 68 to 70, not overheating the baby or overdressing, not having the baby sleeping on its belly, always place it on its back to sleep. Don't have the crib bumper pads, don't have stuffed animals in the crib or excess clothing or blankets or anything like that. Make sure no one smokes around the baby. You can use a pacifier. You can use a fan in the room. It is helpful to have the baby's bassinet or crib in the parent's room, but not to have the baby in the parent's bed. That is very important. But those things like owlets and the little attached pulse oximetry and heart rate monitors, those have not been shown actually to reduce the risk of crib death. Also, I should mention breastfeeding is extremely protective against crib death, and infants who are not breastfed are twice as likely to have SIDS. And that's not meant to give any guilt, but just to really encourage you if you are trying to breastfeed. Any amount of breastfeeding is good, and breast milk is beneficial, even if it's not 100% of the volume of what the baby is drinking. Now, there are certainly special cases, such as babies who are discharged from the NICU who have maybe continued ongoing O2 requirements, oxygen needs, and they would need to have continuous pulse oximetry. That's different. So obviously, if you're followed by a pulmonologist or a neonatologist and they have specific requirements or monitoring for home, absolutely do that. That's a different situation. I'm talking about regular babies who are healthy otherwise. The problem with the monitors is they go off a lot. They have so many false positive alarms that the parents can learn to become, you can't help it, but just complacent because it goes off all the time and you don't believe it. So really it doesn't offer much benefit. And in studies, it really didn't show any improvement. So I know it seems like it might be reassuring and that you could sleep better because of it, but actually that is not the case. So if you have any questions, let me know. This is, as always, general medical advice and not meant to be taken as an individual advice for an individual patient. Hope that made sense. Thanks, guys. Bye.